how did you get involved into studying this? Because I'm sure you could have done a whole host of other things. But I'm glad you're doing this because I'm glad someone's doing this because this is so important. But like,
Yeah,
how was your career geared towards this?
kind of funny. It's a hard area to get into because it's so technical. I mean, it requires a lot of things. You sort of have to understand how healthcare works. So you get a lot of healthcare researchers who understand the healthcare system, but they're not trained in policy and politics. For somebody with a political science background to get involved in healthcare, you really have to do a lot of digging and a lot of basic work understanding the system before you can actually see what's happening and why. And um, the problem is a lot of researchers, I mean, we've got so many really good health services research, but because it's such a huge animal, a lot of the research looks at, small issues like, what are good primary team models? What's a good funding model for, which are really important issues, but it doesn't give you a sense of the larger landscape. You're making me sort of own to my age here, but again, when I was a graduate student in Britain, I broke my arm quite severely and ended up in a hospital. And I was put in a room, and they sort of forgot about me for a few days, and which outraged my this political sensibilities of my friends. And what was happening is that the hospital, the whole NHS was in a state of major health reform through the Griffiths reform. So these are the first Thatcherite reforms, which brought in the market model, the that the first major. Of course, Britain went through a lot of major healthcare reforms, and I thought, being caught up in the middle of it, I thought that was really quite interesting. But um, you know, it- again, it really does take a lot of footwork to be able to say, see what's going on. But with the advantage of age, you really have a longer horizon, so you can look back and you can see why things happen, and what was going on, and what the trends are and how things are changing. So yeah, it does become easier over time.
Is it a, sort of a maze? I guess do you have this a mind that loves to put together puzzles, or do
It
you
is.
want policies to change to? Sorry, go ahead.
No, it is. Some kids have a very physical sense of taking things apart. You have stories about kids taking apart toasters and whatnot and putting them back together, and I think some people enjoy doing that to abstract systems as well. How does the system work? And of course, with healthcare, it's gears within gears within gears. And the Canadian healthcare is really one of it's amazing that we're actually doing as well as we are, because not only do we have a lot of the same problems that every other healthcare system has, primary healthcare, shortage of healthcare workers and whatnot, but we have to do this and negotiate, federal provincial dynamics on top of everything else, right? Which adds another level of complexity to an already, very wickedly complex system. So it is a bit of a Rubik's cube, if you will, or if to
Got
use
it.
a Star Trek reference, three-dimensional chess.